Hello, my name is Dr. Carmen Burke. I am a family holistic dentist practicing in Boulder, Colorado. A lot of my patients come to me telling me that they have chemical sensitivity, and I am getting more and more. So I met Orrie Gartner. Is that correct, your name?
That is correct.
Yeah,
Yes.
and he's an environment specialist, and we were talking about that. That's why I invited him to come to our practice to tell us more about what is multiple chemical sensitivity. Hi, Orrie. Thanks
Hi.
for coming.
Thank you so much for having me. I really appreciate it. To give you an idea of what a multiple chemical sensitivity is, it's a disorder in which there's an adverse health response or effect from a chemical. So a chemical could be anything from fragrance laundry detergent, it could be a dryer sheet, it could be chemicals that people put on themselves, such as it could be a scented deodorant, it could be a cologne or a perfume, and it could also be something such as a biotoxin, such as mold, for example. It could be fresh paint. We are surrounded by chemicals in the 21st century here in our living spaces, and we don't all understand how some of these can affect us. And for some people, these types of chemicals create adverse health effects. And the adverse health effects can range from anything from a migraine to stomach pain to sinus issues to something such as serious as anaphylactic shock. So it ranges from individual to individual, and it can be quite serious. The term is multiple chemical sensitivity. It's also known as environmental illness, you may hear it as. And it was first kind of coined back in 1987. And it's a difficult disease to understand because it is different for each individual. So one individual may have an anaphylactic reaction, for example, to a perfume or a cologne, and another individual may have a stomach pain from that same cologne or perfume. And so the analogy I like to give is people have their autoimmune system when at birth, we hope, is working very, very well. And throughout our lives, we're inundated with a variety of chemicals, whether they are man-made, whether they are in nature from pollens and things like that. And our body has a natural detox system to do that with. And you can picture your immune system as a cup, for example. And when you're born, it's empty. And over time, it gets filled up because we're getting inundated with all these chemicals. And again, they could be man-made, they may be ones that just naturally occur in nature. Pollen, dog, or cat fur, for example. And our detox system should be able to get rid of this. So as the cup fills up, your immune system is filling up, then the cup should be draining throughout our lives. And you never want it to overflow. Well, for people with chemical sensitivities, their immune system has reached a point in that cup, it has filled up to a point where their immune system can't handle anymore. And then now they're having adverse health effects from everyday chemicals. They could be cleaning agents. So 1 in 3 people here in the United States have adverse health effects from fragrance chemicals. So it's about 33% of the population. It's quite a few people that have some issues.
Yeah, and how can they know that they have that?
So how does one know? There's a test that people can take, and it's called the queasy test. It's a quick environmental exposure and sensitivity inventory. It's a mouthful, so that's why it's called queasy. And it is essentially a symptom diagnostics. So a healthcare practitioner will provide the queasy test to an individual, and they can determine, based on the results of this test and what the individual, how they fill out, where on the continuum they are. And it is a continuum, so some folks may be mildly sensitive and some may be highly sensitive. And kind of where they fall on that can gauge on whether or not they have chemical sensitivity. There's a lot of folks out there that often you hear will say, oh, I don't like the smell of that air freshener, or I don't like, I can't be around cars because the smog affects me. But they may not actually be diagnosed as chemical sensitive. And to help with that diagnosis, that's where the queasy test comes into play.
Oh, okay, that's good. And how can they get help?
So luckily, there's some physicians that do specialize in chemical sensitivity and that have experience in environmental medicine, if you will. It is a growing field, and there's a lot of holistic health practitioners often will specialize in MCS diagnosis as well, and to get some help. Admittedly, though, since it is fairly new, it's not something that's been around for hundreds of thousands of years. Obviously, this type of disease, it's really come about in our more modern society. It's still something that is not as well understood in all areas. So it is important to find a health practitioner that is knowledgeable in this space and is aware of it. There is no substitute for medical advice, obviously, but there are a lot of support groups. An organization like EI Thrive is one that helps individuals that suffer from MCS or multiple chemical sensitivities. I should also note that employers, when someone is looking for employment, there's a lot of employers now that are sensitive to this matter, and you hear things like fragrance-free workspaces, and that's to accommodate these 1 in 3 individuals who suffer from chemical sensitivities.
So here in Family Holistic Dentistry, we are fragrance-free because we have a lot of patients that actually I knew about that from a patient that told me I can't work if somebody is wearing perfume. So since then, we decided to just go fragrance-free for all our patients, and we try to use the cleanest material to do our dentistry, and also for cleaning, we're buying the less like a fragrance-free and less chemicals and things, just for people to feel fine here in this office.
That is fantastic that you're doing that, and it's wonderful that we now live in a day and age where there are those options of the fragrance-free that you can use. And that you are taking advantage of that for your clients. That's great.
And what recommendations do you have for them?
So for people that have chemical sensitivities, again, it's related to an autoimmune type disease. So strengthening the body's immune system is the best thing to do. And there's many for everything, exactly. Whether it's chemical sensitivity, just your own general health. And so, how does one improve their immune system? Well, a lot of it is improving the body's ability to do detoxification. And we do what I refer to as the LAF protocol. It's LAF. So it's lifestyle changes. Could be things as simple as moderate exercise, walking 30 minutes a day, help those lymph nodes and the lymph system kind of be activated. Exercise is great. Drinking water. There's a lot of lifestyle type things you can do. So that's the L in the LAF. The A is avoidance. So avoiding chemicals. So coming to your practice here is avoiding the fragrance chemicals, because you do have a fragrance-free environment here. Thank you for that, and people who are chemical sensitivity would much appreciate that. So there's the avoidance factor. And then the final one is the F, is food. And food is a huge component. If we take in good food, then our body can digest, and the gut is the key to the immune system, improving the digestion. So food is a big factor for that. And improving one's food choices helps with folks to help heal themselves from chemical sensitivity. There is no pill one can take, there is no cure, if you will, but it can be managed.
Okay, so thank you very much. I hope this is very helpful for you guys. It's an important information, and I will add all his information, his website, in our links as well for you to read more about it. Thank you very much, and thank you for coming.
And thank you, Carmen. Appreciate it. Thank you.
Thank you, guys.